Hello everyone. Today's video is about the herb teasel and whether it can be used to treat or be part of a treatment for borreliosis, also known as Lyme disease or chronic Lyme disease. Just before jumping into the content of the video, if you don't mind taking a quick second to please like, share, subscribe, and or post a quick comment on my video, I really appreciate it. And thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. And if you need health advice, please talk to your healthcare provider to get that advice. So I posted another video about 6 months ago by the looks of it. It was called Can Cryptolepis Alone Fully Address Lyme, also known as Borrelia? And so somebody posted the question saying, so Cryptolepis being an herb that has quite a decent amount of research backing for its use in treating Lyme. I talked about that in the video, obviously, and then somebody asked the question, what about teasel? So thank you for the question. Teasel is an herb that I used to use all the time. The kind of origins of folks using teasel in Lyme treatment, to my understanding, I believe in part stem from a Petri dish study, and just for sake of comparison, to my understanding, really the only studies that have been done looking at herbs to treat Lyme specifically, Borrelia specifically, and as well as some co-infections, have been Petri dish studies. So it's not like, oh, this is just a Petri dish study. There's so many, much better quality, human trials or animal trials that are out there using using other herbs. Like, nope, it's still fairly rudimentary in terms of the level of scientific evidence for using these herbs to treat Lyme and co-infections. Thankfully, we have a wealth of clinical experience in the community of folks, those of us out there that treat complex chronic illness and chronic infections and things like that, and these herbs can work very, very well. Anyways, Petri dish study showing that, if memory serves, there was I believe a lipophilic extract, so a fat-soluble, kind of a fat-derived extract of teasel, and that Petri dish study did show some anti-Borrelia effect. So that's, I believe, one of the reasons that folks think about using teasel for treating Borrelia. And then the other reason, if memory serves, there's an herbalist, his name is Matthew Wood. He's written a number of different books out there, and I believe he talks about using teasel for treating Lyme. Please don't quote me on that. I could be wrong, and if I'm misspeaking, at the very least, I hope mentioning Matthew Wood's name might bring him a little more, folks interested, more interest in folks about his work, because I think he's really a very interesting herbalist. Talks a lot about sort of non-typical applications of different herbs, and I think he's quite a smart guy. So I believe he talks about that as well, but again, please don't quote me on that. But a little background there on teasel. So in my earlier years of practice of treating folks with chronic illnesses, including chronic infections, I've been treating folks with chronic infections for about 12 years now. In my first couple of years of practice, I'd regularly include teasel root extract as a tincture in my combination tinctures that I would recommend for folks dealing with known or suspected chronic infections, including Borrelia. And to be perfectly frank, I found that those herbs worked fairly well. I thought they had good antimicrobial properties to them, and we saw clinical improvements. And I would typically combine the teasel with other herbs, like Japanese knotweed was a common one I used then, I still use now. There's another herb called Stellingia sylvatica. I use that one a fair bit. I think that one was popularized more by Dr. Dietrich Klinghardt. I was a medical doctor out of Washington, really brilliant doc who's been talking about treating chronic infections before it was cool. He's been at it for I think 40 years or something like that. Anyways, some other herbs in the mix as well, but those are some of my kind of go-to favorites. Another one called sarsaparilla. Trying to think of memory lane here. I think cat's claw was a common one for me back then as well, which is still one of my go-to herbs. But maybe after say 2 or 3, 4 years of using those types of herbal protocols, and I thought seeing good results with those. I was using other therapies as well, doing IV therapies, supporting patients' gut health, boosting their immune system, doing different injections, different things like that. I started really taking a look at the work of Stephen Buhner. He's an herbalist, passed away within the last couple of years or so, wrote a lot of really great books on Lyme and co-infections. I mentioned him several times in other videos of mine, really brilliant guy. And I took a look at his work. It's like, these protocols make a lot of sense. They were using herbs that I wasn't previously using in my practice. And I thought, well, let's give these a try. And so I started phasing some patients over to the Buhner protocols, which maybe weren't getting quite the results I was looking for with the other herbs that I was using. And I had some new patients coming in. It's like, well, maybe let's try, the Buhner protocol, see how that goes. Some patients would come in asking about the Buhner protocol. So it's like, sure, let's give that a go. And by and large, pound for pound, I saw better results overall with using the Buhner inspired protocols. So herbs like Cryptolepis, which inspired the video that this question was posted on, Alcornia, Sida acuta, an herb called Hutunia, an herb called Isatis, still the Japanese knotweed and cat's claw, which are fan favorites, and there's other ones as well. He talks about Lomatium, talks about Andrographis. There's various other ones out there, but the ones I listed first are kind of my go-tos that I typically use. And so I found that when I started dosing or recommending those herbs to patients and generally increasing the dosage of the herbs a bit as well compared to what I was doing before, I found that the results seemed to be better. I also found that those herbs were working well for other conditions too that weren't Lyme or co-infection related. So for example, the one of the herbal formulas that I work with that has a combination of Cryptolepis, Alcornia, oh my gosh, I'm trying to remember what's in it. I just cut and paste my formulas. We call it systemic antimicrobial tincture number 1. It's got 4 of the 8 herbs that I mentioned earlier. So I believe it's I think it's Cryptolepis, Alcornia, I think cat's claw and Japanese knotweed. Or no, Chinese skullcap. That's the one I keep forgetting there. So yeah, Cryptolepis, Alcornia, Chinese skullcap, and I believe cat's claw, I think, are all in systemic antimicrobial formula number 1. And that's a go-to formula that I'll recommend, yes, for folks with Lyme or co-infections, but I'll also recommend it for folks who say have urinary tract infections, because these herbs are really good at getting into the circulatory system, gets into the blood, filtered by the kidneys, into the bladder, can be really helpful for killing off UTIs. It's a go-to formula that I'll recommend for folks who are dealing, say, with lung infections, like anything where I want the antimicrobial herbs to go systemic. These herbs can work really well, and so kind of further proof in the pudding that these Buhner-inspired formulas were working well for my patients was that I was seeing oftentimes very good results with these more like acute infection type issues. Of course, one of the challenges and features of a lot of folks dealing with chronic infections is that their treatment protocols can become quite chronic as well. Sometimes it takes a few months, several months, sometimes years to get a person all the way, work with the person to get them all the way well. And so sometimes it's kind of hard to gauge. It's like, well, yeah, the herbs, like we think they're doing things, but like maybe it's that mitochondrial support, maybe it's the mold protocol, maybe it's the heavy metal detox. We're oftentimes doing multiple things at once. So whenever I had the opportunity to recommend something to a patient or like a treatment change, and where that change is a single variable, it's really valuable. So again, in my earlier days of switching patients over to the Buhner protocol, it's like, oh, you were on, say, a teasel containing formula and Stillingia and whatever was in there, and now I switched to the Buhner formula. Oh, this is working better. Well, that's really relevant, useful clinical feedback, I think. Or again, patients where it's like, oh, I've got a UTI. Oh, I went on these herbs and it, cleared up within a day or two. It's like wonderful. Again, really good clinical feedback that these herbs seem to pack some really good punch. Very simple question, it says, what about teasel? Well, that's what I think about teasel. I think it's a fine herb to have in the mix, but it kind of fell out of favor in my practice to make way for these Buhner-inspired herbs. But maybe if I brought teasel back into some of these formulas, maybe it would work better. Or maybe the tincture form doesn't really work that as well as it could because, again, the research literature, the limited literature that's out there, such as it is on a fat-soluble derivative, and tinctures generally primarily extract the water-soluble components of an herb. So maybe it's those are underrepresented in there. But so it's an herb I have fond memories of, but it's not something that I prescribe very often anymore. Not that I have anything against teasel, just that I've moved on from teasel, shall we say. But if you're listening to this video and you've tried teasel and you have any feedback you'd like to share about it, I'd be interested to hear it. I'm sure folks who read the comments would be interested to hear about it as well. So did teasel help you? Made no difference? Made you feel worse? Like what happened? So if you don't mind sharing that, that would be lovely. And otherwise, if you have any questions on this topic or anything else, just post it in the comment section below, and I will do my best to answer as soon as I can.